It is a big subject. It is the future of research. If we will look at the amount of research in the last 20 years, it's increasing regarding the cancer and obesity. So starting with the announcement of the American Cancer Society, they concluded that obesity is the second only after tobacco as a preventable cause of cancer. So it is a very important subject to look for in a national-wise and international to address it as a strong cause, a preventable cause for cancer. What's known so far? What's the relationship of the obesity and cancer? It's been studied, there is so many studies that correlate obesity with the cancer. The International Agency of Research on Cancer concluded that there is a consistent evidence that the obesity is strongly correlated with cancer. And also they commented that there is a higher risk if you operate with someone with a cancer and he's obese that he may get another cancer unrelated to the first one. The vast majority of the studies that lead to this conclusion was mostly a retrospective cohort. And this could be done in another way to make a more conclusive conclusion. So how high is the risk of cancer with the obesity? It ranges between 1.2 up to 7 times higher risk with obese individuals than comparing to normal population. 1.2, we can talk about the multiple myeloma, and 7 times endometrial cancer. 13 types of cancer have been found to be correlated with obesity. This picture shows the type of cancer that is correlated: thyroid, breast, endometrium, ovarian, pancreas, kidneys, colon, stomach, liver, gallbladder, name it, multiple myeloma, meningioma. So there is so many cancer that is related with obesity. So how come, what's the mechanism that leads to cancer in obese patients? So the first hypothesis that nobody disagree with is the estrogen. We know that there is hormone-related cancers like breast cancer, endometrial cancer, and ovarian cancer, and mostly you will get benefit with even minimal amount of weight loss in female, especially postmenopausal females. Also, the researchers found that the insulin and insulin-like growth factors is strongly related with the colon, pancreas, and the renal cancers. And we all know that with the obesity, these hormones are shooting up, and they are prone to develop type 2 diabetes. Chronic inflammatory conditions. We know that the obese patients, they have cytokines and inflammatory markers everywhere there, and they are prone to some chronic infection like gallbladder disease, and this all relate and leads to cancer in that particular part of the body. Adipokines, like the leptin and adiponectin. Leptin is low in obese patients, adiponectin is high in obese patients, and these all correlate with cell division and can lead to cancer. Another metabolic regulator, like the mammalian target of rapamycin, has been shown to be really strong correlation with the cancer in obese patients. There's so many studies talking about this metabolic regulator, and so on. But I'm just addressing the most important biological mechanism that leads to obesity. So, if it's a weight, it's preventable. We can decrease the weight, and we can decrease the risk of cancer. So in one study, the non-surgical intentional weight loss of even as low as just more than 5%, the hormone-related cancers has shown to be decreased, the risk of developing the cancer has shown to be decreased, like endometrial and breast, especially in older age or postmenopausal age. So what's the role of bariatric surgery? We have a big tool here. Over the last 20 years, the amount of research about obesity and cancer is increasing steeply. So we can see that every year we have a more research for cancer than the year before. And most of these studies has a retrospective pattern, and there was so many different meta-analyses that reached the same conclusion. So what's the, is it a hormone, is the weight loss related with the hormone related cancer more than the non-hormone related cancer? In previous studies, most of the studies were concerned about the hormone related. So there was a positive correlation between weight loss and hormone correlated cancer. But the recent meta-analysis almost all concluded that there is a reduction in at least 5 non-hormone related cancer with weight loss after bariatric surgery. So in these studies, there is so many vast studies that reach the same conclusion. The main points that I get from these studies that their average follow-up is 5 years. There is a studies which reach 10 years follow-up, I mean, in a retrospective manner, but most of them has a 5-year follow-up. Cancer wasn't the main endpoint in most of these meta-analysis. The average age was a higher age, which is a 47-year-old, and we need more studies in the younger age to reach a better conclusion. 2/3 of patients were female, and we know that most of the cancer in females are hormone-related. So if we do a gender-specific follow-up long-term with an endpoint of cancer, we'll get more specific and more strong correlation with weight loss and cancer. Another big point that even though we are doing bariatric surgery the whole world every day, and still even in the United States, they said only 1% of the population underwent bariatric surgery. So we're talking about a very small population comparing to the whole population. So is it weight loss per se that decrease the cancer, or there is a metabolic effect? So if we take in consideration modalities of weight loss or surgeries, bariatric surgeries like gastric band, and we compare it to sleeve gastrectomy or bypass, this will give us a clue that is it only weight loss, or there is a metabolic effect in these kind of surgeries that leads to decrease in the risk of cancer. This study that was done in Cleveland Clinic showed there is a correlation with the amount of weight loss and the decrease of risk of cancer. So the more you lose, the more protective you will get from cancer. And I think this agree with the fact that weight loss is strongly correlated with decreased risk of cancer. But when you look at this study, which shows the association between weight loss and serum biomarkers with the risk of incidence of cancer, we can see that the black line that goes down is the people who lost less than 19% of their weight. And the other two lines up there showed between 20 to 35 and more than 35. Mostly the researcher found that the less than 19% weight loss was after placing a gastric band. So there could be another factor, not only weight loss, I mean the metabolic effect of cancer protection in the sleeve gastrectomy, bypass, etc., other than the gastric banding or let's say by balloon or intentional weight loss. So they look at the biomarkers, glucose, insulin, proinsulins, C-peptides, leptin, ghrelin, all these hormones was strongly correlated with a protective amount of, or the percentage of cancer-free. So the more the hormones have been changed, either decreased or increased, the more protective the surgery is against cancer. So there is definitely a metabolic effect, and as more as the metabolic effect, we will get more protection of cancer. It is a deep subject. I mean, if you go through literatures, you will find a lot of controversies. Even if we talk about the esophageal cancer or the gastric cardiac cancer and esophagus cancer, we talk about the colon cancer, we will see controversy that some studies conclude that there is an increased risk of colon cancer after bariatric surgery, and there is an increased risk of cardiac and esophageal cancer post bypass or sleeve gastrectomy. So there is controversy about these two subjects, but on the other side, you will find meta-analysis that approves decreased risk of cancer in colon cancer and in colon and the cardia and esophagus. So more studies needed actually to reach conclusion in these two subjects and to dig more on the type of surgery, gender specific, and we need the prospective studies, and we need to look more with the metabolic effect and to address, as I said, the colorectal and esophageal cancer risk and whether it increase or decrease. So that's it. Thank you very much.